Hey guys, welcome home. Let's see. I realized this is episode 10 or something, and I have never introduced myself. My name is David Allen. I'm a acupuncturist herbalist in Encinitas, kind of northern San Diego area. I graduated from PCOM San Diego back in 2007. I've been practicing ever since, and then I also teach at the college, so I've been doing that for about 10, 11 years now. My specialty is pediatrics. That's kind of what I'm known for, although I do treat some amount of adults, but mostly I'm treating kids. And so you'll hear me kind of using those as my prime examples for different things because that is generally what I'm seeing. So anyways, if you ever want me to come and speak at your wedding or something, I'm happy to do it. So so I want to talk today about spleen Qi deficiency and kind of give my perspective on kind of what I'm seeing, how I think about it, how I talk to patients about it. So, the thing is, like, especially with the kids or with adults, when you ask them, "Hey, how's digestion?" Right? This very general question, they say something like, "Oh, my bowel movements are every day," and then that's it. Right, which is why we like to give more specific questions. How's your appetite? Do you get full easily? Do you if kids get full easily, that's usually a sign of stomach yin deficiency. It's kind of that hungry doesn't want to eat phenomenon. They get hungry, they will eat, but they get full easily. So kind of that's the full easily is almost like looks like it doesn't want to eat, right? They don't eat very much. So it's kind of the yin deficiency thing. There's heat, but they can't support the movement, the digestion portion. Does your kid complain of their tummy hurting and these kinds of things, right? So we're talking about chewing, we're talking about saliva production, we're talking about how strong is the stomach muscle in its ability to digest, mash the food, stomach acid production, pancreatic enzyme production and release, these kinds of things, right? It's more than just bowel movements. So one of the things, especially this is a bias towards pediatrics, but I think this is true to a lesser degree in adults, which is the question of the development of the spleen qi, of digestive strength, and how that relates to acupuncture and herbs, right? Because the assumption of somebody coming in, child or adult, coming in for a digestive issue, and let's say it's a pretty simple spleen qi deficiency issue, then my assumption is that I'm not going to have to see them forever to prop up their digestive system, and then the minute they stop getting treatment, it goes back to being worse. My assumption is that I'm going to treat them a certain number of times. They start to feel better. They hopefully get to 100% better. Then they stop coming, and it stays good. But the interesting thing here is, what are we assuming has happened when things stay good? Right? And in pediatrics, it's certainly the way that I think about it there is that let's assume that mental emotional development is happening at a sort of neurotypical, at a quote unquote normal rate. Everything is developing properly. But let's say the digestion is just kind of lagging behind a little bit. Everything for them is good. Everything's fine. But then, they just have a little bit of a digestive issue, and it turns out it's spleen qi deficiency. That's the indicator to me that the spleen qi is kind of lagging behind other development processes. Right? And in adults, we're just saying, oh, your spleen qi is a little weak, which means the strength of your spleen qi is a little bit behind the other things, everything else being good, let's say. So in kids then, when I do acupuncture, when I give herbs, my assumption about that is it's not that I'm like propping up their digestive system. Rather, it's that I'm pushing on that development so that it gets stronger. And then when I take the treatment away, they stay good. And that's why I was saying I think this is also true to some degree with adults, but it's harder. It takes a little longer. It's not necessarily always my assumption that it's going to hold for as long as I expect it to in a kid. But I think this still applies. Acupuncture almost works on an informational level. You're telling the body to do something. Push on this development, right? Then I take the treatment away, development stays good, and the kid stays good. This is nice. In pediatrics, we say any change you make during childhood, they have a tendency to hold all the way through adulthood. So you make a kid's digestion stronger, you speed up that development, they hold that change, meaning they have a stronger digestion now, and now you've pushed them forward on that scale, so to speak, and as adults, then they have a stronger digestion. So this is a nice thing to do, right? But then you get into the question of things like digestive supplements. The most common being, probiotics. And my experience with probiotics is that they don't really seem to do anything for the digestion as a general rule. Maybe with the exception of so-called spore types that increase availability and absorption to the right area. But in my experience, because I have so many people come in and say, my kid has X, Y, and Z digestive issue. We've been giving probiotics, but nothing really has been happening. And I mean, I can't count the number of times I've seen that be the case. And it's quite rare for parents to be like, oh, we gave probiotics. And then, maybe there's a whole slew of people out there that gave probiotics and it did work. And then that's why I didn't see them. So maybe my bias is a problem here. I don't know. But I do notice to some degree that probiotics seem to help the immune system to some degree. But I would love to get feedback from other people, and I know there's a lot of, things floating around with probiotics. Do they work? Do they not work? Do they really colonize or not? There's a whole argument going around that probiotics really don't colonize in the way that we were sort of thought when it first this thing first came out, like, oh, I'm going to take probiotics and they're going to colonize my gut and do all this work for me. And there's an argument that the research seems to indicate that that's actually not the case, that whatever probiotics you take, whether it's a product, whether it's food you eat, it usually is getting killed off within a day or two by your regular gut flora. That doesn't mean it's not worth doing. Actually, that means you need to take it every day, because in that day or two that it's surviving, it's working a lot of magic in there. So it's certainly worth doing. But to some degree, this notion that it's colonizing, doesn't matter. Do I care? I don't know. But they don't seem to do a whole lot, in my estimation. But again, my bias may be there. If you're screaming at your car right now, I'm sorry. Send me an email and educate me. You get things like stomach acid supplements, right? So bovine sourced stomach acid supplements, and this can be very useful, of course. This is to my mind, a much more direct kind of digestive supplement. Works quite well, more in adults. I haven't tested it out too much in kids. If they made a kid-friendly one, I might be inclined to try it more. But you take things like digestive enzymes, and often combined in one pill. And these things do very directly help the digestive system in a lot of patients. Not everyone can stomach it, so to speak. Some people, when they take digestive enzymes or when they take stomach acid supplements, they get digestive issues coming out of that. And we could maybe think about why this might be happening. But a lot of people do get a lot of benefit from these things. But what I notice about it is that the minute they stop taking those things, then their problem comes back. It doesn't seem to have the same training ability that the acupuncture and the herbs seem to have. I don't know what the difference there is. This is a whole other question and argument. We can talk about, whole foods and all these kinds of things, as far as the herbs go, and the acupuncture working on the nervous system and the, central and peripheral nervous systems and stuff like that. It's a very different animal. But I think it's an interesting thing nonetheless, something that I observe. Anyways, so when it comes to this question of spleen qi deficiency, I thought what was interesting to me, or what is interesting to me, is to take kind of a survey of where I'm seeing it in my clinic. So like, for example, you take something like food allergies, food intolerances, right? And this is, of course, treating kids is a very common place to see this stuff. And first, let me say kind of how I describe this to the parents. And let me start this with an apology. I know that this is fairly simplistic, but I think it's a useful framework, at least for the parents, and it's a useful framework at least to start with in the way that we think about this stuff, which is, what is a food allergy exactly? What is a food intolerance? Whether it's a straight out allergy, whether it's just a kind of more generalized intolerance, just some patient who, when they eat wheat, they notice it's a problem. They get X, Y, and Z symptom, but not enough to call it out and out allergy. So these people kind of live in this, a lot of the times they kind of live in this sort of limbo zone of like, I'm not diagnosed, but I do notice problems, and then now I just can't eat bread anymore. What let me talk about it in terms of how I talk to patients about this, especially parents. I'm thinking about it and I'm saying, look, okay, to some small degree, what is a food allergy? It's usually some kind of reaction to a protein, right? Because if you look at what a standard list of common food allergens tends to be, you get things like dairy, you get wheat, you get eggs, you get soy, then you start getting into things, corn syrups, you start getting into weird things like strawberries and nightshades, and there's a whole list of possibilities here. But one common thing that underpins all of these foods tends to be this presence of proteins. Right? So in dairy, it's the casein proteins. In wheat, it's the gluten proteins. And then comes the question, though, of digestion. And where does spleen Qi deficiency fit into this, right? Because what we're saying here is, for example, you take like a gluten protein. This is an incredibly complex protein, far more complex than like meat tissue, muscle tissue, that we would eat, like beef or chicken or something. What a protein is it's this complex protein made up of amino acids that are all bonded to each other, right? And your digestion's job is to break down the connections between each individual amino acid, the amino acid kind of being the smallest part of the protein. And all of those bonds have to be broken between each amino acid. Then each amino acid can individually move into the bloodstream, and then they either go to your liver to be recombined into something else that you need. A lot of them just go straight to the muscle tissue, straight to the organs where they're used sort of in situ there. So that's kind of how digestion's supposed to work. Your body breaks these proteins down. Now, where the food allergy thing comes in is then if the digestion is relatively weak and it's not breaking these proteins down completely, then what you can get is kind of half-digested gluten proteins, half-digested casein proteins, half-digested soy proteins. These half-digested proteins, they're not supposed to be able to get into the bloodstream. Your body's just supposed to handle it through the digestive system, send it out in the stools. But that doesn't always happen, especially via the so-called leaky gut phenomenon, which doctors don't necessarily know what to do with, but it's been well established that it exists. You get this inflammation in the gut. And the cause of the inflammation is a whole different kind of question. It may be from these foods. It may be from something else entirely. You guys know the litany. But the presence of this inflammation in the gut lining then opens up these holes, and now these half-digested proteins can get into the bloodstream. And the problem there is that your body is not set up to deal with these half-digested proteins except through an immune response. And that's generally what your body will do. So what your body will do is, we say, when the spleen has damp, where does it send it? It sends it to the lungs. And this is a very common thing that you see, which is when somebody has, say, they eat bread, what's a really common reaction? I get a stuffy nose, right? Or, like we would say in Chinese medicine, the more bread and the more dairy, the more damp foods you eat, the more lung phlegm you're going to tend to have. And that's going to not necessarily show itself on the day-to-day per se until you get older. Or it may show itself when you get sick. Then suddenly you're very, very phlegmy, and it's not sure where this is all coming from. It's this underlying phlegm that's building up in the lungs. But if it's the way that we would think about it, this is the way this was described to me, is that these proteins, these half-digested gluten proteins, casein proteins, get into the bloodstream. Your immune system basically has a couple of options. What it does, the way it was told to me was what your body should do, What you want your immune system to do is to actually recognize it as a virus, because viruses are just kind of protein packs anyways. And so then what it'll do is it'll basically sequester it and then send it out through the orifices. So they pack it in another protein called mucin, gets out into the orifices, comes into contact with fluid, becomes mucus, and then that's why you get a lot of people get stuffy noses when they eat bread. It's just, your body just thinks you have a cold or something like that, right? And this would be a more normal reaction. But then what can happen is your body can have a more kind of a different kind of immune reaction, which is more of an inflammatory reaction. So a more kind of systemic inflammatory reaction, where then your body kind of goes into emergency mode and tries to push those proteins out. And so one really common thing to see is like skin conditions. And so again, now here's where my training in pediatrics comes out, because it's so common to see kids having food-related eczema issues, where there's all that inflammation in the skin, and it's worse when they eat inflammatory type foods of this nature, indicating a food allergy, a food intolerance. But it's the presence of those proteins getting into the skin, your body having reactions to that. It's an inflammatory reaction in the skin, right? Those inflammatory reactions can get into the brain. And this is less clear to me, but it may be, maybe if somebody has a congenitally weak blood-brain barrier, where proteins that shouldn't be getting through the blood-brain barrier get in, and then they affect the brain, causing inflammation. Those are the people who are complaining that when they eat those proteins, they get foggy-headed, right? But are they actually getting into the brain? Maybe maybe the brain inflammation causing the foggy headedness is actually an extension of the gut inflammation, so that you don't actually need a faulty blood-brain barrier. Because I don't even know what I would do about that anyways. So these kinds of questions arise, but the point being that you do get these systemic kind of inflammatory conditions happening. Right, so you get things like anaphylaxis, peanut proteins causing anaphylaxis. It's just, in a sense, it's a very out of control inflammatory reaction, right? And when I think about this in pediatrics, I'm thinking to myself, okay, here's what it looks like to me is spleen Qi deficiency, because it's a food-related thing. You ate something and you had a reaction. That's automatically spleen, and automatically there's spleen deficiency because you're not digesting something. And this isn't even sort of integrative Western medicine thought process. This is Chinese medicine. But then there's also it could be a damp reaction, but then there could be also a heat reaction, right? So to me, the damp reaction is sort of the stuff coming out of your orifices, boogers and snot and the mucus and stuff. The dampness also probably being that foggy-headedness and that kind of thing. But then you do get more out-and-out heat reactions like eczemas. And I mean, eczema is always kind of a damp heat condition in the skin, but where's the heat coming from? So you're having this heat reaction, right? The anaphylaxis looks like this rising heat phenomenon, right? Okay, so this then is, in a pediatric sense, when I'm dealing with food allergies, the main thing that I'm dealing with here is strengthening the spleen qi, so that they're not having these damp reactions, and then the damp isn't turning to heat, and so it gets rid of that damp and that heat further down the line. But at the beginning of the line is the spleen qi strengthening. If I don't strengthen the spleen, they won't be digesting those foods, and they will produce dampness, which to my mind is probably these half-digested proteins getting into the bloodstream, right? So why does one kid have one reaction, another one another reaction? I think there's many, many reasons that are possible. Constitution, all kinds of things, right? Okay, so this little shtick, this little bit, in a sense, this is kind of how I talk to parents about digestion, because when I speak to patients, I never use Chinese medical jargon, almost never. Because I want to give them something they can understand. I want to give them something that's useful. So for me to say, "Oh, your spleen, your qi," and it's not helpful. So if I can give them something that they can understand in a language they can understand, i.e., Western medicine, then I feel like I get better response from them as far as the trust they put into me, as far as the ability to learn something about themselves that may be actionable. right? So then when they're reading on Google blah blahs, at least they have some knowledge that they're kind of forearmed with to go into that situation with. So if I can educate them, then when they're doing research, they can sort of use my education as a new foundation from which to jump to parse out all of the information on Google, right? So this is kind of how I think about it. This is why I talk about it this way with my patients. I just use that Western medical jargon, digestion and the foods and the complex proteins and the breaking down of amino acids and the proteins getting into the bloodstream and then the downstream effect of that. And then I always move it towards whatever the specific situation the kid is coming in with, then we move it towards that. Right? Because it might end up being a question of not even food allergies in general. The kid may come in with asthma, and then the parent says to me, do you think that my kid's asthma could be related to food allergies? Well, gosh, I mean, from a Chinese medicine standpoint, it's not that hard to guess at. But from a Western medical standpoint, something that I can explain to them, you might have to think my way through that problem. Okay, in this case, your kid's asthma is due to sort of chronic inflammatory condition of the lung tissue, and it's leading to inflammation is leading to swelling of the airways, which is inhibiting gas exchange. But are the food allergies exacerbating that? Possibly. Why? Because here's the mechanism. It starts with digestion, and now we end up with inflammation, and it might help to explain at least some of the underlying problems related to your child's chronic inflammatory condition of the lung tissue. Okay, so that's why these little monologues end up being kind of useful, because it can, when the patient asks the question, you can have an answer. It's something that they can understand. Okay. So anyways, that's one thing there. Food allergies, food intolerances, and the like, and kind of how I think about that. Speaking of asthma, though, the most common type of asthma is related to what I was just describing, kind of these chronic inflammatory conditions related to respiratory issues and that. But there actually is, of the 4 types of asthma, one of them is a spleen Qi deficiency type of asthma, but it's very uncommon. In fact, really the only times I've ever truly seen this is like in pretty serious diseases where you get the buildup of the buildup of the mucus in the lung tissue, things like cystic fibrosis, right, where the phlegm and the damp is just filling the lung tissue and blocking here this gas exchange. And so then they'll get sort of asthma-like symptoms, difficulty breathing, wheezing, this kind of thing. But in this case, it's due to damp obstruction of the lung tissue. Remember, we talked in the very first episode here about the qi obstruction of the lungs. Now here is a damp obstruction, and literally these fluids are filling up the airways. Right? So then this would be a sort of what we would call spleen type asthma, because generally, like the asthmas that I'm seeing that are more what we call the lung type, is more these kind of lingering heat pathogen types. These are generally fairly dry. You're going to auscultate, you're not going to hear those crackles and stuff in there. I mean, there's the assumption of mucus plugs there, but it's not, you're not hearing it. They consider it generally dry. So anyways, spleen type of asthma, since we were talking about it. You get things like, what else do you get? Speaking of the respiratory system, you start to think about things like snoring, breathing with your mouth open. You know, this is quite a popular thing nowadays, and the way that mouth breathing affects your facial structure and how it affects how your whole body works. I mean, nitric oxide, you know, everything about how you're really meant to breathe through your nose. And it's interesting here, one doctor told me, one Korean doctor told me, he goes, mouth breathing at any point, whether it's during the day or at night, people who breathe through their mouth, it's because of spleen Qi deficiency. And then my mind was immediately like, oh, right, like the musculature of the mouth, because the mouth is a digestive organ, so the musculature there must be kind of weak. You know, there's not much qi in the mouth, so the mouth hangs open. And he said, yes, that is true. And then he kind of gave me a smile, and he said, because I knew he had something fancy to say, and he said, and also what's happening there is the spleen, because there's spleen Qi deficiency, remember that the digestive system gets its qi from food to some degree, and the lungs gets its qi from breathing. And so here in this case, people who are walking around with their mouth open, especially if they're breathing through their mouth, the issue here is that the spleen is so desperate for qi, it's trying to get it from the air. So it's looking at the lungs and saying, I could probably do that. And so it tries, but of course it doesn't work, right? And your teeth are falling out and all that. So this is interesting because you walk around, and you just look at everybody and you can see all these people walking around with their mouths open. Kids, adults, whatever. And it doesn't matter if they're breathing through their mouth. If they're not breathing through their mouth, then it's a slam dunk. But if they are breathing through their mouth, then it's spleen qi deficiency. But what if their nasal cavities are stuffed? They got a stuffy nose and they can't breathe through their nose, and then they're breathing through their mouth. That's still spleen deficiency. That's that dampness getting in there probably, if it's a chronic issue. Right. So, but this issue then of snoring, I was always taught that snoring at night is a dampness issue. It's kind of like a damp swelling. It kind of closes the airways to some degree. So part of a snoring treatment should always include this spleen dampness kind of question. And this is certainly true for kids. I treat it quite a bit in kids as sort of like a secondary thing, because the parents don't really bring their kids to me for snoring. It's more of a question that I'll ask, and then we'll treat it and it'll go away. But this spleen deficiency damp thing. Okay. Another symptom, spleen qi deficiency symptom in sleeping is, people who when they sleep, their eyes are a little open. And you can just sort of see their eyes open. You can't tell if they're awake, and it's a little creepy. They actually say that symptom is a sign of spleen yang deficiency. Whether they are spleen yang deficient or not, in a sense, it's more of a constitutional thing. And it's because remember that the spleen and stomach rule the eyelids. And so if there's not enough yang in the spleen, then the qi won't hold the eyes closed. The yang of the spleen and stomach won't hold the eyes shut. And so you get this with like ptosis during the day. It's kind of droopy. Well, but then at night, there's a whole other thing where certain people just have that thing. And so this is said to be... and I've found this to generally be true. People that I know that have that issue, they do tend to be kind of spleen yang constitutional types. Sweet and really personable and nice, but maybe not as robust as they could be. Maybe a little bit qi deficient to my eyes, and probably something that'll come out a lot later as they get older. But anyways, where else do I see this in sleep? They do say in pediatrics, and I think this is true to some degree in adults as well. Maybe I haven't been in practice long enough to really see this, but they say that people who sleep on their stomach, so people who sleep prone, it's a sign of spleen deficiency. And they actually say, it was the same Korean practitioner, he said to me, he goes, because when you have spleen qi deficiency, then you'll try to face the earth while you sleep to gather as much earth qi as you can. I always thought these were fun little things. These are the little things I like in Chinese medicine, these little explanations. So you're facing your stomach towards the earth to attempt to gather more qi. So what's a funny thing about this is that I have patients as adults who, as they got older, started to sleep more on their stomachs. Like, I never used to do that. I used to sleep on my back, which is always a sign of heat. And people who chronically sleep on their back, especially when their arms are raised or their arms are splayed out, legs and arms splayed out, it's a sign of that. Of heat. But then as that heat begins to decrease as they get older and their spleen qi deficiency starts to come out, they'll actually start to notice that if they get a little insomnia from some fluid deficiency, but then they'll also have spleen deficiency, and they'll flip over onto their stomachs, and then they can fall back asleep. Right? This is not an uncommon thing. More pediatrics examples. Bedwetting. Most common kind of bedwetting that I see is kids who sleep too deep to wake up. Just as simple as that. 99% of the bedwetting cases that I get, first question I ask is, is your kid a deep sleeper? And the parents invariably will always say it. Oh, yeah. You could get a train going through their bedroom and they'll sleep right through that. It's amazing. Yeah, this is spleen yang deficiency, they actually say that the explanation there is that the signal of the full bladder isn't rising into the mind. So this spleen yang, this kind of rising problem, so that's almost like a central chi dropping kind of issue here. Sort of thinking about central chi dropping, you get things like we talk about inattentive type ADHD. Inattentive type ADHD, this is the types of kids who are like more spaced out during class. These are not hyperactive kids distracted. These are spaced out kids distracted. It's a different thing, right? So if you're not familiar with this stuff, you got to wipe this hyperactive thing type. This is called the inattentive type. These are kids who, when presented with a math problem, they just kind of space out. They don't get hyper. They're not running around the room bugging their neighbor and blurting out answers. These kids are quiet, sitting in the back, just kind of little wallflowers. They get by, but they never thrive academically. This is more of a spleen qi deficiency. This is more of an intellect problem. The yi, right? This aspect of the shen related to the spleen. So you see those kids. I love getting these kids because there's rarely is there really strong emotional content here. So you strengthen their spleen, they do better. That frontal lobe gets stronger, right? Let's see, where else am I seeing this? If you do see these kids and they do have emotional content, it's usually around anxiety, but like anxiety associated with shyness. These kids they're painfully shy, right? So it's kind of like an anxiety. So then that's where the emotional content is. And that, of course, the formula for that is gui pitang, right? So this is spleen deficiency leading to heart blood deficiency. And so the heart blood deficiency is this heart insecurity leads to anxiety, but it's anxiety of a deficiency type. Not anxiety of like a rising heat type like you would see in a yin deficiency type thing or like this. No, this is true deficiency type anxiety. The kid should be shy, so painfully shy that they will go to great lengths to avoid all kinds of social interactions at the playground and this and that. And as they get older, this can get better or worse as their spleen develops or doesn't develop. You see this to some degree in adults, although I don't see it as often as in adults as other types, but still, right? So this would be then the spleen type of anxiety. It's a true deficiency anxiety. We were saying sort of intellect, what a good intellect, a more kind of like deeper sort of intellectual dysfunction here would be things like Down syndrome. Down syndrome would be a pretty classic example of spleen deficiency type intellect problems, because the whole issue here with Down syndrome is, of course, low IQ, their ability to be independent, not dependent on others for their own sort of ADLs, right? Their activities of daily living, simple stuff to more complex things. Can they execute on these activities? Well, it's just an IQ issue. And what's interesting here about Down syndrome is their whole presentation is like a constitutional spleen. They are like the archetype of this, tending to be overweight, tending to be pale, large, round faces, sort of a lot of fat deposition in their hands. They even lose the lines on their hands a lot of the time, which Chinese medicine talks about. They say people who don't have many lines on their hands, it's a sign of spleen qi deficiency, a dampness, and that maybe causes swelling that hides the lines and stuff. All of these things, they are a pretty classic presentation. I mean, I love treating these kids because they are just the sweetest little bugs of all time. I mean, if there was ever a being that was put into this world to show you how to love, it's these kids, man, because they are just so sweet. That is so classic spleen. Spleen type people want to please. They want everyone around them to be happy, and they will nourish everyone around them as much as possible to help with that, to their own detriment a lot of the times. The spleen people have trouble saying no, right? So these are areas where I see this. What else? Well, yeah, give one more example. I'm running out of things that I can remember. Constipation, of course, the coming back, we'll come back full circle to a digestive example, which is, the constipation thing, there's a number of different types of constipation. And the true spleen Qi deficiency type constipation is they are constipated, but then when they have bowel movements, the stools are still soft. It's not like big, fat, dry ones indicating more of the blood deficiency kind of thing. It's not the bitty goat stools indicating more of this liver qi stagnation like we talked about. It's more like soft, pasty, sometimes pencil thin, but just like more soft. And it's an indication probably that the transportation function of the spleen is affected. It's just not pushing things through. Well, in an integrative fashion, this would be like peristalsis is kind of weak, right? So then that's where things like senna and these kinds of things that more strongly affect peristalsis directly and the strength of contraction and stuff can be quite useful. If somebody has really dry stools, the last thing you want to give them is senna, because they'll probably start getting cramps and stuff. It could be quite painful. So then you got to add a glycerin suppository or something. And then the combination of the two may work well enough. But just by itself, with dryness, you can't. So, but with this more deficiency type, this spleen Qi deficiency type, yeah, the senna can be quite useful for just causing contractile function of the bowels to move things out, right? Okay. Probably thinking of a lot more stuff. It's probably enough. Okay, guys, take it easy. We'll talk soon, okay?